Great. After the presentation made by our additional CEO and the talks by the senior professionals here, you always feel, what will I cover? How should I continue? And what is the point? I mean, what was the point that I'll talk about? So then I sat down and tried to put some slides, which I will try to cover and actually talk about and try to answer some of the questions that were raised in the panel discussion, and also try to tell you about how we are, what we are doing from the tech side and what opportunities we have, and how these two things that we've been hearing about, the unified health interface and the health claims exchange, are going to create these opportunities. Next slide. Okay, I'll do it. So the whole idea of Ayushman Bharat Digital Mission and the principle had been, the central principle has been, how do we empower the patient and reimagine healthcare, and eventually come up to a stage where we are what we are calling a learning healthcare system. A learning healthcare system is something that informs the patient, engages with him, empowers him, and finally partners with him in providing the best service possible to him. And in order to do that, these three components: adoption, interoperability, and analytics. These are the three main components that we believe are the drivers, and that is how we'll be able to reach it. And people have talked about, there have been many, the speakers have spoken about adoption and how best we could do it. I'll mainly focus on the interoperability part. And we realized that interoperability itself again has dimensions. One is the transport interoperability, which is simply saying that one system sending data to another system. This problem has already been solved. People have seen, we have SMTP, we have FTP, we have HTTPS, all these protocols, this problem has been solved. Then we have the structure interoperability, which is the other system understands, or they both speak, but there is a grammar in which the systems are able to talk to each other. Lastly, we have semantic interoperability. I think this is the more crucial part when we talk about interoperability within health systems. I mean, there was one speaker who talked about how do these 20-bedded, 30-bedded hospitals, how are we going to bring them onto the platform? I think we will be able to bring them onto the platform where we will create solutions that are interoperable, and they are also able to understand what a 500-bedded hospital with its advanced platform is creating, and that decision and that information is flowing. And there was this talk about task shifting. This could only happen when the clinical decision system is able to understand, learn, and provide those additional inputs, which will actually ensure that each health worker is able to do more and perform better. So the two interfaces that we are talking about, the unified health interface and the health claims exchange, in a way try to address this. And the building blocks that we have built and the protocols on which we are working try to address some of the structure and semantic interoperability issues. So to begin with the unified health interface, I'd say, what are the services that could be enabled by UHI? There was this talk about having an independent platform which doesn't allow a monopoly on any or by any agency. So we said, okay, let us have a platform that actually helps bring all these services: digital consultation, physical consultation, ambulatory services, laboratory consultations, blood banks, organ donation, any such things onto a single platform where people are able to discover the service, book for the service, and avail it, and eventually fulfill. There is a service fulfillment. And what is the UHI going to do as part of this? I mean, in terms of accelerating the health system for the citizens, we want to give them access to healthcare. I mean, a choice of access in terms of not being tied up with one particular entity. It's about a choice, and also giving them empowering them in terms of choosing the right, getting the right prices, and also giving them a control over their data. Similarly, for doctors or hospitals, it is about discoverability. In fact, discoverability is a common thing that we are trying to bring about for the wide gamut of services that we want to bring under UHI. And it is also about fast ramp up. It is basically to bring that 20-bedded hospital or even a single doctor hospital onto the national platform where you are visible, discoverable, and even if you are a first starter, even if you have just started providing the service, you are available for anybody and everybody to search for and avail this service. So this is what UHI tries to do. And it applies to the pharmacies, diagnostics, health tech startups, and anybody who is providing this service. I mean, the empowerment of the patient that I talked about, this whole inform, engage, empower, and partner, this is possible only through the tech applications that you're going to build that will leverage on these building blocks that we are trying to build here. So the idea is to move from this currently existing system of digital health, where it is a siloed system. There is one interface and these are tightly coupled through a particular platform, to this, where the UHI gateway helps as an intermediate layer, which will actually help in discoverability and providing, availability of service, irrespective of which platform you're in. So like I talked about these 3 layers of interoperability I mentioned earlier, right? The transport interoperability, the structure interoperability, and the semantic interoperability. The transport we are taking care by having a protocol, what we are calling the decentralized health protocol. We are using open protocols for such as WebRTC for video consultations. For the structure, we already have, FHIR is part of our DNA. The fast healthcare interoperability resource, we actually created healthcare profiles, which actually help 2 entities which are integrated with ABDM easily, seamlessly share information. And the semantic interoperability, to some extent, I wouldn't say fully, because it is something that we need to explore further and build upon further, is taken care of by things like SOMED-City and LOINC, which are again part of our standards that we are making a part of ABDM. These will evolve even further, because going ahead, we also want systems that can very easily talk to each other. And at the end of the day, if we want to have a clinical decision system that can make use of the information it is receiving from a different hospital, or even for that case, that ASHA or Anganwadi worker who is using an application provided by the government, that application should be able to read the longitudinal health history of that particular patient and then provide alternatives and provide suggestions that this health worker can work upon. So this is where you have these opportunities, and I would urge healthcare mentors and startups and investors to look at what all are these areas in which you can actually mentor and foster new startups. So the components of UHI, like the CEO had mentioned, we are not only building the gateway, but we are also building the reference applications. We have reference applications similar to BHIM, which work as personal health record applications. We have reference applications which are on the left-hand side, one that can work as an end-user application, and also on the right-hand side that works as an HSPA. So your startup can be on either side of it. So you don't really have to worry about the reference application that will respond to your application. So this is something that we are creating. So in a way, we are creating that enabling environment for any startup to take advantage of the building blocks that we are already building. So that is already given. And apart from that, this is something, again, our UHI sandbox is going to be deployed from the 15th of June. It is open. It is open for everybody. Come start playing with it. Start talking to our end user application. Start talking to our HSPA. Start sending messages over the gateway that we have built. This is again open, and it is on GitHub. Be part of it and tell us, like the CEO mentioned, we are eager to learn from you. We are eager to get more and more information from you so that we make the systems even more better. So there is a hackathon coming up, and this is also going to be and one opportunity where all the startups, all the tech companies can actually try out this platform. So this is what about UHI. Now I'll come to the Health Claims Exchange, which is again a very important part, and will also address certain things that was mentioned in the previous panel about decision making, low cost, how do we bring about universal health coverage, etc. The Health Claims Exchange, in a nutshell, tries to do this. The objective is to reimagine health claims processing through an exchange that will help digitize the existing system of claim processing. Today, be it a 500-bedded hospital or a 20-bedded hospital, you all know the pain you are going through in processing your claims by having your claims executives, an army of claims executives who are entering this data in physical format, digital format, email. I mean, these are different ways in which insurers are actually asking you for data. The health claims exchange objective is to leverage on the ABDM building blocks that we have built, and B, try to create a common policy language or objects, claim objects and policy objects that can actually help seamless movement of information from the provider to the payer, so that whatever was currently happening mostly manually today can actually happen in an automated fashion. So the idea is to reduce cost per claim and finally come up with better SLAs, better turnaround times, remove that lockup of capital that providers are currently facing with, because the time that claims are currently taking to get processed. So what are the capabilities of HCX? From an eligibility point of view, coverage eligibility, this is more from a user perspective. We are the whole HCX platform and the associated components can actually help one to understand their eligibility in a seamless fashion. And also things like Abha and Aadhaar are actually also helping in identification and also making this whole claim processing and understanding of a policy even more easier and digitized. Next is the claim status. Today, you might have to talk to multiple systems to understand what happened to your claim. The idea of HCX is to bring everything onto a single platform where you track each and every claim and understand where it is currently, and you have complete visibility of what's happening to it. Then smart contracts. By digitizing and bringing about what is called the policy object or the claim object, the idea is to bring about a smart contract where things can happen in a digitized fashion, things can happen in a faster fashion, and most of things can happen in an auto adjudication mode. Provider information, authentication, and ensuring that it is the right provider which is sending the information for a claim. It is actually that entity with which the payer had a contract, which is sending these claims. And this entire identification and authentication mechanism can be made easier by leveraging on the ABDM building blocks such as the HFR, the Health Facility Registry, and of course the Abha, so that this whole time that an insurer is spending in verification can actually be saved. And then policy details, like I said, the policy markup language is integral part of this whole HCX development, is actually going to make things easier in sharing policy details between the provider and the payer in such a way that things can happen in a more seamless manner. Finally, digital contracts. By digitizing this entire network from end to end, HCX aims to make the life of the 20-bed hospital, or for that case, even a 5-bed hospital, easier. So today, when we talk about software as a service, let's say there is an HMIS, which is providing a layer provided as a software as a service. If it is also able to integrate and talk to HCX, it can make life easier, so much more easier for the 20-bedded hospital. This is where adoption will come from. This is where that pull, when we say that, when one of the speakers talked about how do you also start about thinking about engaging those small players, those small bedded, small hospitals. I think this is one of the ways from a tech point of view that we are trying to engage them. And this is what HCX aims to do. So therefore, HCX as an accelerator can actually help an insurer in insured individual in discovery of services. Again, wallet management, better eKYC. From a provider perspective, it can help create that one interface with which you can interact with multiple multiple insurance providers, and you don't have to go through the hoops of physical to digital, digital to physical, and so on. And from an insurer perspective, the whole process becomes less error prone. It becomes more digitized. And even the amount of money you are spending on processing each claim, amount of time and money can actually come down. And I'm told that the difference between the US and the Indian insurance landscape is, in the US, 95% or maybe even more insurance claims are automatic and digital, and the remaining are manual. In our case, 100% is manual. Our aim is, can we make majority of them what you call digital and automatic, and maybe only 2 or 3% manual where actual checking is required. I think HCX is one place or one tool or one building block that can achieve this. And finally, from a policy maker perspective, if you want to move to UHC, you need to have a good insurance model. If you want to have a good insurance model, you need it to be viable, and you need it to be reliable. And eventually, and you also need the data to be able to price your products in such in a better way. So HCX provides this capability and this data and information for policymakers, providers, and insurers to be able to achieve that goal. And that is what is the opportunity, and that is how we believe HCX is going to accelerate this whole digitization process. Thank you.
Thank you, Kiran. Thank you very much. Good afternoon, everybody. I know we're running out of time, but I think the last session